Hi, it's Hannah here, and today I wanted to talk about a not very sexy topic, which is urinary incontinence in perimenopause. And it's something that affects, we think, around about half of us as we move through perimenopause. Obviously, we don't know for sure because so many women are shy when it comes to talking about it. I understand that completely, but I want to try and reassure you that it is okay to discuss this if it's affecting you, because there are solutions out there which might be able to help. So, in my practice with the herbal medicine, the health coaching, and the hypnotherapy, we tend to use a two-pronged approach. I do get a number of women who have this issue, and I use a completely holistic approach to it. So, part one is we're looking at core strength, because we need core strength and good muscle tone, but we also need hormone balance. So we're doing both effectively. So the core strength is about your entire abdominal strength, not just your pelvic floor. We used to be told to do our Kegel exercises and our pelvic floor exercises to maintain our continence as we moved into old age. But there's much more to it than that. We've come to realize that we need to take a much more holistic view when it comes to improving our muscle tone in that part of our body. And even simple things like breathing correctly, which is breathing in through your nose and breathing deep into your lungs so that you're moving your diaphragm, that's the dome of muscle under your lungs at the top of your abdominal capsule. When you breathe deeply, you push the diaphragm down, and that pushes all of your internal organs in your abdomen downwards. And if you tune into yourself whilst you're doing this kind of breathing, you will notice that it actually pushes your pelvic floor down and up as well as you breathe, because you need to make space for those internal organs to move downwards. So there are lots of really simple things you can do to improve your pelvic floor strength and your core strength. It's not a thing that I'm particularly expert in, so I tend to send all of my patients over to my friend Jeanette Brown, who I've known for a number of years now, and she is expert on what we call vasopressive. So those are those specific exercises which improve core strength for urinary incontinence in particular, and for prolapse as well. So if you want to connect with Jeanette, I'm really happy to put you in touch with her. She's an expert in my Facebook group, which is Natural Menopause UK, and you can find her online at Core Restore by Jeanette. So she takes care of all of the muscle side of things, and I take care of all the hormone side of things. And we do that mainly using our herbs. So when we're looking at urinary incontinence, primarily there's an issue with testosterone, in particular, low levels of testosterone. There are some herbs that will help to gently raise testosterone levels again, and we can use foods, and even, posture as well will help to gently raise testosterone levels. So there's lots of things we can do there. But also, of course, we're looking at it holistically. There's no point just, hitting the testosterone and not taking a look into estrogen and progesterone levels in particular as well. So we're looking at everything, and we're using the herbs according to what we need at the time. Between those two, we often get really good results with urinary incontinence in perimenopause. It can take a few weeks or perhaps even a few months. But if HRT is not your thing, it's a definite contender. It's definitely something you need to be looking into. So I hope that helps. Feel free to comment below if you'd like to, or if you would prefer to have a private discussion with me about it, you can get in touch via my website, which is at www.physichealth.uk. I'll see you again soon. Bye.